back to the Health History Podcast with Kat
and Meredith.
We have a very interesting episode for you guys. Today we will be talking to a group of nurses whose careers span from the 1900s to present day about their perspectives on mental health care and what it was like when they practiced nursing. This will give us a lot of insight on the evolution of mental health care and what progress has been made and what still needs to be done.
And per usual, we will be having a fun fact time where I share some fun, maybe not so fun facts with you all that connect to mental health.
Our first guest today is Fiona.
Hi, everyone.
Fiona practiced as a nurse in the early 1900s. She practiced when mental health care was known as asylum care. Can you tell us more about some of the things you were responsible for when you were working?
Sure. So our main responsibility was to keep order. Every patient had to follow the same strict schedule. They had meals at set hours, bedtime at set hours, and endless rules. Individual needs weren't really important. Sometimes it felt less like caring for people and more like running a strict, regimented household.
Sounds like it. Did the patients ever act out against these rules? What happened if they did?
Punishment was very common. Some were placed in seclusions and others were restrained. There was a punishment we called time in a chair, where a patient had to sit silently for hours. If there were any smiles, head turns, facial gestures, anything that us nurses thought was an attitude, we would increase the time in the chair. It was supposed to allow for reflection, but many patients felt like it was harsh or cruel.
How did it make you feel to put them in those situations? Did you think it made them better or that you were treating their illness?
I don't really know, but it was hard. One specific time that stuck with me throughout the years, a patient of mine was begging with their eyes to help them, but instead I had to keep busy and remove myself from the situation. I did what I was told because it was my job, and they said it was in the best interest of the patient, but I could tell that they were wanting help.
Wow. This is a super important perspective to hear and can help with a lot with education on mental health care. Thank you so much for your time.
Of course.
Next up is fun fact time. Take it away, Meredith.
It's fun fact time. So, did you know that in the late 1800s and early 1900s, mental health problems were often treated like a bad cold? Back then, if someone was anxious, depressed, or exhausted, doctors didn't really want to call it mental illness. Nope, they called it a nervous disorder or a physical imbalance, and the cure was tonics and pills. One famous company, Dr. Miles Medical, sold a restorative tonic and blood purifier, and I'll enter this right here. The blood purifier claimed it could cure tainted blood, sterility, and miscarriage, and even childhood ailments. And get this, they said purifying the blood could also improve nervous and heart conditions. Basically, mental health and emotional struggles were framed as...
So next up, we have Diane here.
Hi.
So Diane, you were a nursing student back in 1964-ish. Tell me a little bit about your clinical rotations in the psych unit. Where did you complete those during school?
Oh, I did not enjoy doing psych at all. The patients were terrifying. During my senior year, we worked at what was known as the Lunatic Asylum, but they officially changed the name to Dorothea Dix Hospital right before we started. I think they realized that it was making the place look bad, and they wanted to lessen the stigma surrounding it. It was different because back then, if someone was mental, you weren't really supposed to talk about it.
Well, I'm glad they changed that name. It definitely didn't make it sound like a place where people were getting better. When were you there? Did you see anything, like treatments? Did you get to
When
do
we
anything?
visited the psych ward, it was in the East Wing too, and they had lots of private rooms with windows to look in at the patients from the hallways, but it wasn't a locked unit, except there were 2 locked rooms that patients could be put in that were kind of like, ooh, and all of us stayed away from those. One thing that was also super important was to stand every time the doctor entered the room, and we had to follow them around every time they made their rounds. We weren't allowed to have anything with us, but I do specifically remember always seeing the doctor carrying this small black box around the ward. It was used for electrical shock treatments, which were performed a lot.
Sounds like there was a lot of hesitation around the patients, and the doctors definitely obviously thought those treatments were effective. Thank you so much for your time, Diane. We really appreciate your insight. Now, time for another fun fact.
It's fun fact time. So, back to talking about the tonics. These tonics contain ingredients such as phosphates, iron, and were marketed as safe, gentle, and tasty. These ads especially targeted women, claiming to help with the female weakness. They suppress periods, miscarriages, and hysteria, and people actually believed it worked. One woman, Miss Jacinta Martinez, said she suffered from hysteria and felt completely restored after taking the tonic. Sleep better, feel better, and all from a little iron drink.
Next, we have Kara joining us.
Hi.
Kara here was a psychiatric nurse in the early 2000s. What is your opinion on mental health nursing? Did you really enjoy your job?
I couldn't imagine any other way. I truly loved it. I feel like the behavioral health era of our profession has such a negative stigma around it, but truthfully, in my opinion, us psych nurses are the most well-rounded nurses around. It's not a job that can be done by just anyone, and those of us who can do it very well. It makes me sad because I feel like all the other specialties just don't appreciate our field or understand everything the role involves.
You sound super passionate about your job. But are you saying other nurses and professionals in the healthcare field don't see your job as like super difficult or important?
Yeah, as if we just sit around and act as babysitters all day, which is just not the case at all. I can see how some may think that, but a lot we did have impacts much deeper than are visibly accounted for. Patient-centered care was a must. The patients are always the priority. Keeping our emotions in check has always been a very important part of our job. Sometimes we'd have to be quick on our feet and make crucial decisions when patients start to go haywire, but still remain calm and effortless in execution so we don't cause further chaos in the unit. I believe that adaptability, critical thinking, and most importantly, empathy we had to show every day is so much greater than the skills of a general registered nurse. It's what makes our role so specific.
Thank you so much for all of this insight into what mental health nurses do and the complexities of this specific care. I think this is super important for everyone in healthcare to know, and it sounds like you really care about how your patients are treated.
Well, thank you for having me. I'm very thankful for the opportunity to share my experience and what mental health nursing truly is. I feel blessed to have built such meaningful relationships that help my patients feel seen and heard, as they deserve the same humane treatment that anyone in need of care does.
Thank you. Time for another fun fact time. Go ahead, Meredith.
Okay, last fun fact time. So looking back, it's been kind of fascinating and a little scary how mental health struggles were treated as physical problems. Today, we know anxiety, depression, and other disorders need evidence-based therapies and sometimes medications. But back then, nope, it was just a tonic and a lot of hope. It really shows how societal views and stigma shaped mental health care and how far we've come.
And last but certainly not least, we have Jaylee here.
Hey everyone.
Jaylee is a nursing student today at UNCW. Can you tell us a little bit about your perspective of mental health nursing today and what your clinical experience has been like already?
Yeah, mental health to me is so important. So far, my clinical experience has been very eye-opening. Seeing patients that are struggling with mental health firsthand has shown me that it's very important to not only treat the patient physically, but also mentally. Supporting patients mentally by listening to them and supporting them along their journey is very important, even when you're not in a mental health clinical, but every other clinical as well. Seeing the things we learn in class firsthand, such as therapeutic communication and taking a non-judgmental approach when helping a patient, has been very interesting to watch and to see the big difference these things make when caring for a patient who is struggling with their mental health.
I'm so glad that you're liking it and you're able to witness all of these things firsthand. What are your thoughts on where mental health nursing is today? Do you think it has improved? And where do you think more improvement can happen?
Mental health nursing has come a long way in a short amount of time, but there's definitely a lot of room for improvement in the field. Even though there is still a stigma surrounding mental health, it has improved throughout the years and patients are starting to get the resources they need to start feeling better. With that being said, there is still a big issue with some communities not being able to gain access to these resources, whether that's because of cost, they live in an area with no resources, or them being scared of judgment from others. Some different ways to change this would be increasing telehealth visits, reducing costs, and helping reduce the stigma that surrounds mental health itself. I'm very glad to be a part of the nursing generation today because I think we can be the change. With us students being the future of nursing, it is important that we advocate for our patients' mental health and mental health education and come up with different ways to make resources easily available.
That's awesome. You sound so very educated and know where this progress is still needing to happen. Your perspective and experience is so important as you're the future of what nursing can be. Thank you so much, Jaylee. Thank you so much for joining us on this episode of the Health History Podcast. We hope you enjoyed your time learning about the history and evolution of mental health care.
Stay tuned for our next episode. See you next time.
Bye.
Health History. Bye.